Hello everyone, I'm Dr. Shambhavi Singh, Editorial Fellow JIPO, and today I'm here to have a discussion with Drs Suarez and Dr. Ruiz from the MD Anderson Group, Division of Cancer Prevention and Population Service. I welcome you to this interview and I would like you to introduce yourself.
Thank you. I'm Dr. Juan Ruiz. I am instructor in the Department of Health Services Research at MD Anderson Cancer Center. Thank you for this interview.
Yes, hello, and I am Maria Suarez-Almazor. I am a professor in the Department of Health Services Research and in the section of Rheumatology and Clinical Immunology at the University of Texas MD Anderson Cancer Center.
Thank you. Thank you for the kind introductions. And I would start with my first question. Here goes my first question. A key question in the oncology practice during the global pandemic has been whether the immune checkpoint inhibitor treatment leads to any different COVID-19 outcomes. If you could discuss how your systematic review adds to fill an important evidence gap and that supports our clinicians.
Okay, well, the results of previous studies were inconsistent, with some studies reporting no increased risk in adverse outcomes in cancer patients receiving immune checkpoint inhibitors, whereas others reported a higher risk compared with other therapies. When we decided to conduct this study, a few prior systematic reviews had examined COVID-19 outcomes in patients with cancer receiving immune checkpoint inhibitor therapy. However, our systematic review adds in the following aspects. First, it has more updated literature search. Second, it evaluates several clinical outcomes, including immune-related adverse events, unlike other reviews. And finally, it includes also case reports. Case reports and case series are important to identify unusual immune check-related adverse events that may not be identified in the cohort studies. In our systematic review, immune checkpoint inhibitor therapy was not significantly associated with worse COVID-19 outcomes compared with other cancer therapies or with no therapy. No increase in immune-related adverse event was reported, but most studies didn't evaluate immune toxicity secondary to immune checkpoint inhibitor treatment. We found a few case reports describing different unusual adverse events. However, while attribution is not possible, they can alert researchers and clinicians to these severe toxicities.
Thank you for all the insights, Dr. Ruiz. I'll move on to the next question. If you could briefly discuss the interplay between immunotherapy, the immunosuppression, and the COVID-19 outcome in patients with cancer.
There is a high risk of adverse outcomes from COVID-19 in patients who may be immunosuppressed, including cancer patients treated with chemotherapy, patients with human immunodeficiency virus, and those receiving immunosuppression for their condition. So, for instance, individuals with autoimmune disorders and those who have undergone solid organ or stem cell transplants and are treated with immunosuppressants are at risk of worse outcomes. Overall, patients with cancer and COVID-19 do have a higher risk of developing severe disease and death. This was reported in a large observational study, a national database that was conducted by Dr. Chavez-McGregor from the Department of Health Services Research at MD Anderson Cancer Center. However, in this study, the type of cancer was really important in influencing the outcomes of COVID-19. So patients who had recent cytotoxic therapy had worse COVID-19 mortality, but those who received immunotherapy or targeted therapy, they did not have this association with an increased risk. So immune checkpoint inhibitors, we know that they enhance immune responses in an indiscriminate way. And because of that, they can cause inflammatory and immune-related adverse events in non-target organs. Because some of the critical complications of COVID-19 are thought to be caused by an exaggerated immune response that can result in a massive release of cytokines. It's conceivable that patients with cancer who receive these agents, who receive checkpoint inhibitors, and they acquire COVID-19 might be at risk of developing such complications. However, not enough studies examine immune-related adverse events, specifically in these patients, for us to draw firm conclusions.
Okay. Thank you for an answer. I would field in the next question. That's your observations on the identified study cohort. That is the patients on the immunotherapy treated cohort and the patients in the non-immuno checkpoint treatment cohort.
Thank you for the question. The studies were quite different with respect to the cohorts included and the methodology. So we identified overall 21 cohort studies. 3 were prospective and 18 were retrospective. Among them, about 16 reported mortality, 7 reported hospital admissions, 4 reported severe COVID-19 infection, and only 2 reported immune-related adverse events, as I mentioned before. So therapy with immune checkpoint inhibitors was compared with many different control groups. So in 13 studies, it was compared with chemotherapy, in 11 with target therapy, in 6 with hormone therapy, and in 3 with chemotherapy plus immunotherapy. In addition, there were 6 studies that included control groups of cancer patients without any active treatment for their cancer, and 1 study included a control group of patients who had COVID-19 but did not have cancer. The studies also included patients with various cancer types. Because of these variations in study populations and in the design of the study, it's difficult to infer outcomes for a specific group of patients, for instance, for patients with a specific type of cancer. Also, not sufficient data was provided to adequately discern the potential effect of other important covariates. Only a few studies performed multivariate analysis and adjusted for different confounders that we know are important, for instance, age, sex, ethnicity, other comorbidities, smoking, cancer type, and very importantly, anti-COVID-19 therapy.
Okay. Thank you, Dr. Suarez, for answering that question. I move on to our last question of the interview. If you could summarize the evidence, particularly including studies, evaluating the prognosis of the COVID-19 patients with cancer receiving immune checkpoint inhibitors.
Thank you very much for that question. I will take that one. Overall, we didn't observe statistically significant differences in mortality, hospital admission, or intensive care unit admission when comparing cancer patients treated with immune checkpoint inhibitor with cancer patients who were not receiving active cancer therapy or other cancer treatments, including those studies which adjusted the results for other covariates. In the 2 cohorts that examined the rate of immune-related adverse events, no immune-related adverse events were observed. In summary, COVID-19 clinical outcomes in patients with cancer receiving immune checkpoint inhibitor therapy appear to be similar to those of patients receiving other cancer therapies or patients without treatment at the time of infection.
Thank you very much. We at JIPO really appreciate your time in doing the interview to discuss a very unique cohort of patients, that is COVID-19 and cancer with immune checkpoint inhibitors. And I'm sure it will be very insightful for our viewers. Thank you very much for joining today. Thank you.
My pleasure. Thank you.
Thank you very much.
So much.